How you
Everyone
doing?
can have any comment, and then we'll go around the circle. It's
Yep.
good to see you all.
Session back in. State of the State's done. A lot of work ahead of us, and happy to talk about any of it. Sergio?
Hi, Governor. I want to talk to you about your constitutional carry bill. We saw it in the budget. It has a cost of $17 million, and it says it goes towards incarceration costs for people who break the law. I want to know how this aligns with your criminal justice reform plan, because this is going to lead to more crimes and more incarcerations at the end of the day.
You know, constitutional carry is legal, and we will be the 17th state in the country. Many states, Vermont, New Hampshire, neighboring states like Kentucky, Missouri, understand that this is important. It is important that we protect the Second Amendment of the Constitution. That's what this bill will do. The costs associated with that will be used for appropriate measures. I think it's completely consistent to protect the Second Amendment and advocate for criminal justice reform at the same time.
How is that, just follow up, how is that criminal justice reform? Because it's going to put more people in jail, potentially. So, I mean, it seems like a contradiction.
The constitutional carry statistically does not equate to greater gun violence, greater need for law enforcement. One of the safest states in the country, Vermont, one of the lowest crime rate states in the country, Vermont, has had constitutional carry for decades.
Governor, I noticed there was nothing about the paid family leave thing that you proposed last year in early 2020. Is that in the works at all? Is there anything there, or is that potentially not going to happen?
That's not a part of our legislative package. That may be something that's brought up by the legislature. As you know, there'll be a number of bills brought forth, and we'll be looking at them as they come forward, but it's not in our package this year.
Why not give it another shot this year?
You know, there are a lot of things that we had last year. The COVID response required that we remove a number of those from, in fact, any of those that had a cost were removed from our budget, and so we reprioritized this year, and that's not one of the things that we're prioritizing this year.
Does it seem like there's no movement from the legislature in terms of support for that?
I haven't spoken with legislative members that may be bringing that forth. We may see that soon. Natalie?
Governor, Senator Rossi and Representative Hawk filed their own plan for TANF. I'm sure right now your administration is probably going to be talking with them about what they plan to do. Is that something you think you could support, the proposal they're putting forward, and what components would you put in yours?
Yeah. The good news is I think that we will have a modernization of TANF. We have a new Department of Human Services Commissioner, Clarence Carter, who actually oversaw the federal TANF program, brings a tremendous amount of expertise into our administration. There are a number of things that need to be done. So we will be working together with Chairman Watson to make sure that we get the best way forward for the TANF program in our state.
And do you have any update on vaccine appointments and whatnot? I think there was discussion about the state moving to an online system that when people do that. Where do you stand on that?
Yeah, so we will be developing a new ability for folks to sign up for vaccine, and you'll be hearing more about that in the days to come. We expect that there will be more vaccines coming online in the next few weeks. We're excited about that. We're ready for it. We have a plan for it, and we will move into new phases when we get more vaccines.
So about how many more vaccines are you all anticipating, and do you have a detail in the next phase?
Yeah, so I wish I could answer that question. The federal government gives us vaccines for the vaccine allocation for about 3 weeks at a time, and then they change that allocation. They haven't indicated what it would be, but I have had conversations with officials from Pfizer, in particular, who have indicated what their commitment to vaccines would be over the next couple of months, and it's significant. You know, exactly the time frame when that will equate to distribution in Tennessee, we don't know, but we're encouraged that it will be within weeks.
Last week, the AG's office announced a settlement with the easy round where the state's going to get $15 million. I understand that the state has contracted twice for some
You'll have to talk to the AG's office about timing on that, but we have certainly contracted with consulting firms throughout the years to bring expertise for a particular issue, but I can't answer the specific timing of those. You'd have to refer to the AG's office.
And the current contract that expires in April is for government efficiency purposes. Your budget that you posted on Monday has a $5 million allocation for efficiency. Is that anything related?
I'd have to look at, I'd honestly have to look at the line item that you're talking about and see if it relates to the particular contract. But again, we have a number of contracts over the years with consulting firms that bring expertise that we don't have within state government. So, but I can follow up and answer that specific.
Governor, I know that a lot of the small not-for-profits have just been murdered this year because they rely so much on in-person fundraising. And I know it's also for people helping themselves instead of always going to government. There's a bill out, and it was misrepresented a few weeks ago, there's a bill out to legalize, to allow like BFWs and not-for-profits to do a 4-hour bingo game once a week. They're saying if you let us do this, we can help ourselves, we don't have to always go to the government trough. Your thoughts on Bruce Griffey's bill that would allow them just 4 hours, 1 game a week to maybe get themselves out of this hole?
Yeah, I haven't. I'll say about that bill, which I'll say oftentimes from in the next through this session, there are a lot of bills out there. When they get closer to my desk and pass through committee, then I'll comment on them. But I don't know the particulars about that.
My follow-up is on the TANF. You know, a lot of criticism on the Fed. You know, it's a lot of money, and government always doesn't do things well, as you know. Even the federal stimulus, giving money to people who never were out of work for an hour, people like myself. I mean, didn't need the money. So how do you make sure, what are your thoughts on making sure to get the most bang out of the buck for TANF and not have it be one of this government panic, throw the money at people?
Well, let me just say there are a lot of people who do need the money. We have a lot of Tennesseans who, through this pandemic, have had great challenges financially. First of all, that's important to remember. This fund is intended to assist needy families, and that's exactly what we want it to do. It's one of the reasons that we're proposing actually a 25% increase in the allocation for those families. But we also have in our proposal addressing fraud and waste and abuse. We have put in place incentives to incentivize work programs within this. But it's a comprehensive strategy that will modernize and improve the way we use those funds. But those funds are specifically designed for and will be used for the folks in our state that need them.
We've talked to quite a few metro school teachers who have crossed county lines to get the vaccine. Do you think that the vaccine rollout has been going smoothly? I know that teachers in town start getting the vaccine starting February 20th, but some students are already going back because of this phase-in approach. Some teachers don't have this vaccine. So do you think that it's been going smoothly? Could we have been more on top of this?
So, you know, we've been consistently ranked in the top 10 of states in the country with regard to our vaccine rollout plan and the efficiency of it, the number of folks that have been vaccinated. The former CDC director said that Tennessee's plan was the most medically sound and practical plan in the country. We're very pleased with the way the plan has rolled out. Certainly there have been bumps and there will be along the way. But our plan has also been very risk-based, and you talked about teachers who have been prioritized and put in priority. They're the next in phase. But our focus has been on the most vulnerable. So a 70-year-old is 27 times more likely, I believe, to go into the hospital and die from COVID than a 40-year-old, teacher or anything else. My focus has been on getting those who are going to be sick and die from COVID vaccinated first. That'll continue to be our focus. It's science-based and risk-based strategy for vaccines, and we think that's what we ought to be doing as a state. So that's been our focus. But we will, as vaccines increase, we will be vaccinating teachers in the first priority after the elderly, and we think that's the right way to go.
And kind of on a different note here, but there's a bill going around that would prohibit female high school and middle school students from participating, transgender female students from participating in high school and middle school sports. I know that you don't want to comment until the bill's on your desk, but would you sign that? And if you're not willing to comment, what are your thoughts on it?
Well, that bill came in part as a result of an executive order from President Biden, one of a number of executive orders that came out initially when he became inaugurated. And let me just say, I will say that particular executive order is a tremendous overreach of the federal government into the states. I will say that. I'll also say that I do believe that transgenders participating in women's sports will destroy women's sports. It will ruin the opportunity for girls to earn scholarships. It will put a glass ceiling back over women that hasn't been there, and sometimes I think it's bad for women and for women's sports.
Quick follow-up on that. So there was a mother testifying yesterday in the committee hearing against that bill, saying that it's a discrimination against transgender athletes. What are your thoughts?
My thoughts are that it would be bad for women's sports. It would destroy them.
And my own questions are really quick. So I know that you proposed an unprecedented total amount of rainy day fund being $1.5 billion. What kind of scenarios would you foresee that the state will have to tap into that resource?
A rainy day fund should be used for the most catastrophic of economic events. It takes legislative approval, and it would be the last used funds when there are no funds left to keep the state operating. Our rainy day fund currently stands at an amount that would operate the state for about 34 days, I believe, about a month of operation in our rainy day fund. It's the fiscally responsible way to establish a budget, and we'll continue to keep a rainy day fund so long as it's possible to have that fiscal stability within our state budget. Sam?
Yeah, Governor, the Attorney General is requesting a handful of attorneys in his budget to handle mainly the abortion law that was passed and also the ESA program. And you've also got a couple of line items in your budget dealing with paying special litigators and paying for settlements. Any concern that these are costing the state too much money for some of your main initiatives?
I think the Attorney General's request for legal assistance, like any request for additional resources, we look at every department and the resources that they request. We certainly want to consider that. Our state's growing, thankfully. Its revenues are growing, its population is growing, the resources of departments, including the Attorney General's, are growing. I'll say about those two particular issues. We will defend the rights of the unborn in this state, and I believe that the Attorney General will and should aggressively defend the rights of the unborn children in this state, and I would encourage him to do so. We also believe that children, particularly low-income children in this state, deserve to have a high-quality education. We know the Supreme Court is looking at the ESA bill. That bill specifically will give children in low-income districts of the least performing schools an opportunity to have a higher education, a higher quality education than they're currently receiving, and we should be advocating for that. And I will encourage the Attorney General to pursue that as well.
Hey, sir, let's do final question right here.
Yes, sir?
Yeah,
Go ahead.
okay. Well, do you believe that your lawsuits are costing the state just too much money? Then I have a question.
Well, I think I've said that I think that we should spend whatever is appropriate within the Attorney General's office to defend the rights of the unborn children in this state. And we should also spend the appropriate dollars to make certain that the children in our state, including low-income children and those in the most struggling school districts, have an opportunity to have a high-quality education, and that's exactly what the Education Savings Account legislation will do.
And on
We, in fact, will be partnering with Walmart across the state, as well as other private partners all across the state. As our vaccine numbers go up, we expect to be utilizing dozens and then hundreds of providers to get vaccines out to people in every community in Tennessee.
Sir, would you like to make a closing comment?
No, I appreciate what you guys do. Thanks for the opportunity to speak
I have
today.
one quick question about, I understand there's a redesign for the Memphis mega site wastewater line. Have you heard about that? And if so, do you support it?
There are a lot of proposals for the Memphis mega site. We look at all of those. We have, we have continuous input from folks in the region, legislators in the region. So we'll continue to look at the mega site as an opportunity and as a spot for economic development in the state.